Diagnostic categories that apply to the various classes of psychoactive substances. 2. Harmful pattern of psychoactive substance use. Essential features of harmful pattern of psychoactive substance use. A pattern of continuous, recurrent, or sporadic use of a psychoactive substance that has caused clinically significant damage to a person's physical health, for example, blood-borne infection from intravenous self-administration, or mental health, or has resulted in behavior leading to harm to the health of others. Harm to health of the individual occurs due to one or more of the following: 1. Behavior related to intoxication, 2. Direct or secondary toxic effects on body organs and systems, or 3. A harmful route of administration. Harm to health of others includes any form of physical harm, including trauma, or mental disorder that is directly attributable to behavior related to substance intoxication on the part of the person to whom the diagnosis of harmful pattern of psychoactive substance use applies. The pattern of use of the relevant substance is evident over a period of at least 12 months if substance use is episodic, or at least 1 month if use is continuous. Harm to health is not better accounted for by another medical condition or another mental disorder, including another disorder due to substance use, for example, substance withdrawal. Course specifiers of harmful pattern of psychoactive substance use: 6C4X.10 Harmful pattern of psychoactive substance use, episodic, 6C4X.11 Harmful pattern of psychoactive substance use, continuous, 6C4X.1Z Harmful pattern of psychoactive substance use, unspecified. A specifier is used to further describe the harmful pattern of substance use, using a 5th-digit code. The X below corresponds to the 4th-digit code indicating the substance class, for example, 0 for alcohol, 1 for cannabis, 2 for synthetic cannabinoids, etc. 6C4X.10 Harmful pattern of psychoactive substance use, episodic. This category is assigned when all the diagnostic requirements for harmful pattern of psychoactive substance use are met and there is evidence of a pattern of recurrent episodic or intermittent use of the relevant psychoactive substance over a period of at least 12 months that has caused clinically significant harm to a person or others. 6C4X.11 Harmful pattern of psychoactive substance use, continuous. This category is assigned when all the diagnostic requirements for harmful pattern of substance use are met and there is evidence of a pattern of continuous substance use, daily or almost daily, of the relevant psychoactive substance over a period of at least 1 month that has caused significant harm to a person or others. 6C4X.1Z Harmful pattern of psychoactive substance use, unspecified. Boundaries with other disorders and conditions, differential diagnosis. Boundary with hazardous substance use. Episode of harmful psychoactive substance use. Substance dependence. Substance intoxication. Boundary with substance withdrawal. Substance withdrawal occurs upon cessation or reduction of a substance. Substance-induced mental disorders. Note: specific substance-induced mental disorders are only applicable for some substances or substance classes. Boundary with other mental disorders and other medical conditions. Numerous mental disorders as well as subthreshold symptoms may co-occur with episodic or continuous patterns of substance use. Similarly, continuous or episodic substance use increases the risk for mental disorders as well as other medical conditions. Co-occurring mental disorders and comorbid medical conditions should be diagnosed separately, along with a diagnosis of harmful pattern of psychoactive substance use. Substance dependence essential features. A pattern of recurrent episodic or continuous use of a psychoactive substance with evidence of impaired regulation of use of that substance that is manifested by 2 or more of the following. Impaired control over substance use, i.e., onset, frequency, intensity, duration, termination, context. Increasing precedence of substance use over other aspects of life, including maintenance of health, and daily activities and responsibilities, such that substance use continues or escalates despite the occurrence of harm, e.g., repeated relationship disruption, occupational or scholastic consequences, negative impact on health. Physiological features indicative of neuroadaptation to the substance, including 1. Tolerance to the effects of the substance or a need to use increasing amounts of the substance to achieve the same effect. 2. Withdrawal symptoms following cessation or reduction in use of that substance, or 3. Repeated use of the substance or pharmacologically similar substances to prevent or alleviate withdrawal symptoms. Physiological features are only applicable for certain substances. The features of dependence are usually evident over a period of at least 12 months, but the diagnosis may be made if use is continuous, daily or almost daily, for at least 3 months. Course specifiers for substance dependence: 6 C4X.20 Substance dependence, current use, 6 C4X.21 Substance dependence, early full remission, 6 C4X.22 Substance dependence, sustained partial remission, 6 C4X.22 Substance dependence, sustained full remission, 6 C4X.2Z Substance dependence, unspecified. For all psychoactive substance classes other than alcohol, a specifier is also used to further describe the pattern of substance use or remission in the context of substance dependence, using a 5th-digit code. Unlike alcohol, separate codes for continuous and episodic current use are not provided. 6 C4X.20 Substance dependence, current use, current substance dependence with episodic or continuous use of the substance within the past month. 6 C4X.21 Substance dependence, early full remission. After a diagnosis of substance dependence and often following a treatment episode or other intervention, including self-help intervention, the individual has been abstinent from the substance during a period lasting from between 1 and 12 months. 6 C4X.22 Substance dependence, sustained partial remission, after a diagnosis of substance dependence, and often following a treatment episode or other intervention, including self-help intervention, there is a significant reduction in substance use for more than 12 months. Such that even though intermittent or continuous use has occurred during this period, the diagnostic requirements for dependence have not been met. 6 C4X.22 Substance dependence, sustained full remission. After a diagnosis of substance dependence, and often following a treatment episode or other intervention, including self-intervention, the person has been abstinent from the substance for 12 months or longer. 6 C4X.2Z Substance dependence, unspecified. Additional clinical features for substance dependence: a subjective sensation of urge or craving to use the substance often, but not always, accompanies the essential features of substance dependence. When present as an aspect of substance dependence, withdrawal symptoms must be consistent with the known withdrawal state for that substance. Onset and course of withdrawal are time-limited, and are related to the type of substance and the dose used immediately before cessation or reduction in amount. Tolerance varies as a function of individual factors, for example, substance use history, genetics, and should be differentiated from initial levels of response during intoxication, which also exhibit significant individual variability. Laboratory testing that reveals high levels of the substance in bodily fluids with no evidence of significant symptoms of intoxication may be suggestive of tolerance. Tolerance to the effects to substances as indicated by different psychophysiological responses can develop at varying rates. For example, tolerance to respiratory depression caused by opioid intoxication may develop prior to tolerance to the sedating effects of the drug. With abstinence, tolerance effects diminish over time. Individuals with certain comorbid medical conditions, for example, chronic liver disease, typically have reduced tolerances to substances. Physical or mental health consequences, beyond the essential features of substance dependence, typically occur in persons with substance dependence but are not required for the diagnosis. Similarly, functional impairment in one or several domains of life, for example, work, domestic responsibilities, child rearing, is commonly seen in persons with substance dependence, but is not required in order to assign the diagnosis. Individuals with substance dependence have elevated rates of many other mental disorders. The specific pattern of co-occurrence depends on the specific substance involved, and reflects common risk factors and common causal pathways. These are distinguished from substance-induced mental disorders, in which the symptoms are a result of the direct physiological effects of the substance on the central nervous system. A pattern of substance use that includes frequent or high-dose administration occurs more often among certain subgroups, for example, adolescents. In these cases, peer group dynamics may contribute to the maintenance of substance use. Boundary with normality, threshold. Frequent or even daily substance use of a substance does not automatically imply a diagnosis of substance dependence. There must also be evidence of the essential features of substance dependence. Numerous medical conditions can occur due to substance use in the course of substance dependence. These conditions tend to be specific for each substance, although some are shared across substances. Examples include alcoholic cirrhosis, infective endocarditis, and HIV/AIDS. Medical conditions caused by substance use should be diagnosed separately. Thanks for watching. Please like and subscribe.